We'll now reproduce a restoration on the facial of number 8, class 5, with composite. We begin again with the end in mind, which is a convex surface that will be smooth and confluent and aesthetic to the contours of the patient's original central incisor. We'll place the initial increments of composite, being careful not to overload and not to try to cure it all at once, which could result in contraction shrinkage. Condense it towards the axial wall, and I like to layer at an angle. My preference is to bond the first layer in attaching to the enamel and leave no composite touching the cervical, especially if the cervical is dentin only. We can use a wiping motion to take away excess at the incisal area of the preparation, and then cure our first layer. I'll often use a second or third layer again, keeping mostly in contact with the incisal portion of the preparation and avoiding a full contact with the dentin at the cervical until the final layer is placed. This will avoid contraction shrinkage, where we've often seen at the cervical a brown line of composite where the composite shrinkage has produced an immediate gap. Curing the second layer. We have the benefit with composite of getting our final contours without overfill or with a very minimum of overfill, which reduces the necessity for finishing. This will be the third and final layer where we adapt the composite to the cervical at the gingival. I'm using a beaver tail and the curved portion of the beaver tail to help to conform to the convex surface, moving the composite from the center portion to the outside portions of the preparation. This would be a good point at which to add some composite resin monomer to allow the instrument to release and to develop a smooth contour. Again, take your time, develop the anatomy exactly as you wish so that we can minimize the need for finishing. And now cure the third layer. After the third layer is cured, we can inspect with an explorer. I can see some margin irregularities. There's a little excess flash, a little piece of flash here. Some of these will break away. It might be better to use something like a white stone to finish this, because as we break these pieces away, a portion might carry away a portion of the filling material. If we're trying to chip it away, we might carry away a portion of the material that actually should be part of the restoration. And so we can use a 12-bladed carbide, for example, and finish the restoration to a smooth contour. And then recheck the margins. Your dentist will normally perform this composite finishing with a handpiece. Recheck the margins for smoothness and confluency with the cavo surface of the tooth around the preparation. I can feel just a little more overhang there. It would be time to tell your dentist it's time for a... Bring the handpiece back in. And recheck the margin. We have smooth margins, and this completes the class 5 on the facial of number 8.